Health DG Dr. Sandile Buthelezi joins me now. Dr. Buthelezi, thank you very much for your time this evening. So we had a look there, a review by the Health Minister of which hospitals will be exempt. I want to talk about the practicalities of the exemption. What's the difference between the hospitals who, have a direct line to Municipal Supply and others who are dependent on Eskom directly?
Yes, no, thank you very much, and good evening to you, Iman, and good evening to the viewers. Yes, what we've actually done working with Eskom, which I must thank very much, starting from last week, we gave them a list of hospitals over the weekend, and we as a health, we actually don't know which one is supplied directly by Eskom and which one is supplied directly through the municipality. Those that are supplied directly by Eskom, what normally happens is that it's easier for them to work on the lines because they work directly with those hospitals. But those that are supplied by the municipalities, they have to work through the municipality. And you will find that mostly those that are in the metros, where you've got the entities like your city powers, those ones, that's where they need to work through the metros. And I think that has worked very well for us, because having submitted the list on Saturday, there's already quite a number, as you would have heard Minister mentioning, that some of the hospitals are already exempt. Basically, the difference is how they do it. But also, what they also taught us, which is a technical issue, is that if a hospital is actually linked to the larger supply of the citizens, it's sometimes very difficult, but it's easier if a hospital has got a direct supply or a direct feed, which just dedicated to the hospital. So hence we've actually requested through the task team that we set up that we actually try and see how do we ensure that hospitals have got dedicated feeds so that it's easier for them to be exempted.
So, that's really interesting to hear just, the complexities around it. As you say, you're learning that there would be some technical nuance around that. What does it mean practically in terms of timing for the hospitals that have been identified for exemption to actually benefit from it, in terms of laying down all of this ancillary infrastructure?
Yeah. In some, I think it's been quick in most of the hospitals. As I mentioned, we've now, I think we've got around 37 hospitals which are exempt. Some of them were actually even exempted prior to this. For example, the ones in the city of eThekwini, they were actually, we benefited to the fact that after the floods, there was a special arrangement that was done, so we benefited from that. So actually, they've never had a problem up to about stage 3 or stage 4 of load shedding. What we've now agreed on in terms of the task team that we've set up is that work is ongoing. For example, we are aware that in the Eastern Cape, there's already some work on the ground looking at additional hospitals in addition to those that the minister put up, which will, for example, looking at Khayelitsha Hospital, looking at Mitchell Spain's Hospital, Vredenburg, Paarl, Caledon, and others, also in other provinces. So probably by the time we meet next week, as we will update the public, the 37 would have probably increased because there's a lot of work going on in the ground.
Yeah. And that's heartening to hear. Talk to us about the rural setting, hospitals in the rural areas. We know that there are endemic historical issues around power supply. Even when, the goings are good in the country, one can imagine at a time like this, they're even further disadvantaged. So what interventions and provisions have been made for those hospitals?
Yes, yeah. We must also say that, obviously, this we are now putting in addition to our existing generators. So what we are also doing at the same time is to ensure that our existing generators are well serviced. We have enough diesel so that those areas that might not benefit from this intervention, they still have the generators to depend on and the uninterrupted power supplies. But I must say that surprisingly, from the list of the hospitals that are exempt, a number of them are rural hospitals. If you look at Leboa Khomo, Dilokeng, if you look at others, for example, you look at Ladysmith, you look at Kwamhlanga Hospital, all those hospitals are really deep rural and they've been able to be isolated. I think probably the fact that some of them are rural, most of them will probably have a dedicated feed. Because they are in areas that are not with many citizens where they will be sharing the feed with a number of citizens.
So let's talk then about, you know, just into the future and what the plan is going to be with making sure that there is that integrity of electricity and power supply. Given, as you say, that there will be dedicated generators, we know that the diesel bill is putting an extra financial burden on hospitals that would have to rely on generators exclusively. Obviously, there's you know, a business case to be made, and some people will benefit from that supply and having the situation be as abnormal as it is right now. But is there a plan to transition out of that dependency on diesel-based or diesel-powered generators?
Yes, actually, we have now developed a plan. We are working with our national treasury. We are now moving forward. We are exploring using alternate energy supplies, mainly solar. That's what for us is going to be more important as we move forward. Actually, any new hospital that we're going to be building now will need to have solar panels installed. Yeah. But we are also, as from April next year, we want to start with a number of hospitals and installing solar to ensure that we are not dependent 100% on the grid. But at the same time, as we all know that all the other alternate energy, renewable energy that is there, we will actually want the health to be in the forefront when we move forward. Of course, working closely with Eskom. Actually, that's one of the things that we'll be discussing next week with them. They're going to be coming to us with the technologies that are there already, and we'll then be exploring them in addition to solar, and then working with the treasury. And we are actually willing, as a department, to actually reprioritize our budgets, working with Treasury to ensure that we are able to address this, because we can all see that the grid is not stable and we cannot be 100% dependent on it, nor can we be dependent on the generators as well.
Yeah. Look, the country can hold its breath for a miracle based on what the minister announced today in terms of the constitution of a new Eskom board, but we know that these things take time. Miracles don't happen overnight, so we might be in this situation and in the scope of provision that we've been talking about now for a long time yet. It seems, Dr. Buthelezi, not to be critical, but it does beg the question, if we're able to get these exemptions, what seems to be over a fairly rapid period of time, a short period of time, why were these interventions not proposed much earlier? We've been living with, you know, unprecedented power cut scenarios in South Africa, you know, since 2008, accelerated and becoming worse, of course, in the last 2 years or so, or even more, depending on how you calculate it. Why did the health department meet with all of these stakeholders only now?
Obviously, we've had quite a lot of pressures in terms of the budgets, and I think you are correct. I think we should have considered this a little bit earlier, but probably some hindsight, and we believe now is the right time that we really need to move faster in ensuring that we are able to get to these areas. I must say that obviously we've never really gotten to very bad stages like stage 5 and 6, because our generators have been coping when dealing with the lower level stages of load shedding. So hence maybe that's why we did not consider that. But now it's the right time, and we think we must act. We must not move back.
We'll leave it there. Thank you for talking to us, Dr. Sandile Buthelezi. Dr. Buthelezi is the DG in the Department of Health.